My name is Dr. Stephanie Saunders. My pronouns are she, hers, and hers. I have been at Chase Brexton. It'll be 20 years at that point in time. And I've had the opportunity to serve in a variety of different roles. Currently, I'm a licensed psychologist and a licensed clinical professional counselor, and I'm in the Behavioral Health Center of Excellence, and I am also a member of the Behavioral Health Leadership Team. So truly the sense of community and teamwork. My career predates my time at Chase Brexton, and the team is so talented, and there's such a depth of experience and passion and commitment. And it's really a spirit of collaboration that we do this work together, and that all of our patients are all of our patients, and that we all have something to contribute. And it's a space where I can truly be myself, and I'm just so grateful for that. And my work with patients are amazing teachers. There's always something to learn, and just the daily courage that I see within our communities. So, truly, what inspires me is the opportunity to both give and receive, as a teacher, as a learner, and just the opportunity to do meaningful work. And even if I don't see immediately the difference that I'm making, the advantage of being here over a period of time is that you can look back in retrospect and to see, because change is not something that happens overnight, that there's really a cumulative effect. And just the opportunity to connect, you know, with the team, with patients, it's really new each and every day. There's something to discover, experience, and my sense of curiosity is truly something that, encourages me to be at work each and every day. So that my presence matters, and the opposite, my absence would matter as well. And that there are different ways to make a difference, and that the work is meaningful, it's needed, um, and that there are patients to be seen or colleagues to consult with, that it's the connection and the community. And the work is not easy. However, that helps to motivate me, that I have to continue to strive to grow, because it's not possible to support the process of change if you're not also an active participant in that as well. So, and the environment inspires me. My career has been spent at Mount Vernon, and of course now there's a virtual reality, but just being in the space in Mount Vernon, the surrounding um, businesses or restaurants or places where there's collective memories, certainly are a draw as well. So what comes to mind is really some sacred memories. We started out, or I started out, on Eager Street, and medical and SWAD were at Cathedral, and there's the Wall of Courage. And when we did our transition and shift and moved, that the team came together and carried individually the different tiles of the Wall of Courage, in a way to honor their walk, the patient's walk. And there was candlelight, And it was very, very sacred. It's something that will stay with me for my lifetime. And on a similar note, that we needed, there was a need for monthly memorial services for members of the community that we had lost. And we would again come together. And there is not the need for that now, but there was, and that really speaks to the journey and the timeline of Chase Brexton and the work that we do. And something on a lighter note, that I remember doors being decorated and offices being decorated for celebrations of sporting events such as Festivus Maximus, um, and just the desire to support and understand. There were colleagues that weren't really into sports but respected how Baltimore is really a football town. And after a loss at an AFC championship game, another psychologist came to me, very seriously and said, my condolences that the Ravens lost. And it just was very, very special. And so that speaks to the heart of Chase Brexton. Well, something that has stayed the same, if not grown, is really the heart of Chase Brexton and the reach into the communities, the commitment, uh, the passion, the resourcefulness, and just the steadfast presence for patients and communities. And then I also think the only thing that's constant is change. Um, and when I first started, the team was much smaller. We could fit comfortably into, a reasonably sized room. Um, so now we're integrated at Mount Vernon into the Monumental Life building. And so we're really honoring the integrated care and the one-stop shop. But the commitment to excellence and quality remains the same. I think back, and we used to be called mental health, and now again honoring the integrated care perspective or behavioral health, because that's more all-encompassing. Um, I think of access, that now we are closer to more of an open access model than we've ever been. Because when folks are ready, folks are ready. And it's really about meeting the patient where they're at and when they are ready. And before there were significant delays. So those are just a few of my thoughts. So even though we've really grown, that we have different sites, that our commitment to the mission, vision, and values remains the same. So it's something that I say often, and something that a mentor uh, shared with me. By slowing down, we get there faster. So time is certainly a resource and something we need to be mindful of, but really being in the moment, taking it step by step, day by day, patient by patient, and really looking at things as an opportunity and not so much as a problem or a challenge. And that look for the teachable moments. And that's something that I keep in mind. There's learning and then there's unlearning. So we come to Chase Brexton with a set of skills and experiences, knowledge and belief, and just being open to the fact that we all unlearn in order to learn. So I think I share in the collective hope that Chase Brexton will be a presence in our community for generations to come. That this is only the beginning. And of course, we have a very rich history, But I really do believe that the best is yet to come, that we will continue to grow in a thoughtful and purposeful way while being true to ourselves, our commitment, our mission, our vision, and our community. And just the teamwork, that we don't do this work in isolation. Nobody works alone. And the sense of belonging is something that is a protective factor as well as a curative factor. I really believe that we'll continue to focus on the promotion of wellness and not only, or an emphasis on the amelioration of disease, that will really come from a wellness perspective. And of course, there's different layers to that, and the need for support from partners and other contributors. But that's really where I see behavioral health as well as healthcare going. And again, I have the perspective of time, and I can see shifts over in the field um, over this period. So I think we'll continue to go in the direction that we need to go. So my first reaction is that the colors complement one another and they look even more stunning together, right? So, but I love turquoise. And I know there's different names for different colors, but that's what I think of because I have lots of different uh, turquoise that I wear. And it's a happy color. It inspires me. And I think of the Caribbean and how it's so beautiful on the surface, but also there's depth.